Hello, my name is Professor John Toumbourou. I'm the Chair in Health Psychology at Deakin University. The presentation I'll be giving is on permissive norms and laws related to longitudinal harm for cannabis use. I'm part of a university research grouping at Deakin University that's called the Centre for Social and Early Emotional Development. And within our research grouping, we have a life course research theme that examines longitudinal research. So you can see our research is organised to explore different questions that are important in looking at the development of young people. So we're looking to try and encourage healthy development. We try and explore through the longitudinal life course studies what matters. We also have themes that look at what works and what translates. So today I'm going to be really focusing very much on what we can learn from longitudinal studies. So longitudinal studies can tell us important things about the effects of legalising cannabis, and that'll be what we'll be pursuing today. When we look at the issues associated with cannabis legalisation, we often hear arguments, and commonly you can see a sequence of these arguments that have occurred in many of the places where cannabis has legalised. Typically, cannabis is initially promoted as a medicinal product, a solution to rare and understudied conditions. And then proponents argue, well, it has benefits there, so why not permit recreational use as the next line of argument. Proponents of this argue that legalisation will reduce the harms and the tax returns will outweigh the harms. So these are a fairly important set of claims. Existing longitudinal evidence clearly shows cannabis use to be harmful in the long term. I was part of a consortia that you can see related to a number of the authors that are published in this particular paper. And this is a paper that was published in 2014 in Lancet Psychiatry that was exploring across a range of the largest longitudinal studies in Australia and New Zealand what happens in young adulthood when young people are using cannabis in adolescence. That paper showed that there was consistent evidence that adolescent cannabis use predicted harmful outcomes of cannabis dependence, increased risk of illicit drug use, of having welfare use, and mental health problems. So there was interesting kickback when we published this paper. Many people said, yes, that's the case in countries where cannabis use is illegal, but this will all change once cannabis use is legal. However, the existing literature as it presently stands predicts there'll be harmful consequences of cannabis legalisation. I'll explore a little bit further why I say that. One of the studies that you can look at is this study by Fisher and colleagues published in 2020 this year. And in this study, you can see that where they look at the different countries and states that have legalised cannabis use, what they show is that there is tendency towards increased use of cannabis in adulthood. Not so much in youth, that's not, the jury's out on that one. They do describe a consistent pattern that the price, therefore the availability of cannabis becomes increased because of the falling price. Also, there's more use of higher potency forms of cannabis. The other trend that's consistently being shown is cannabis-related hospitalizations, cannabis-related disorders have an increased prevalence. There's also a trend for more cannabis use on roads. So these are the findings that we have to date. Now, they're not, most people will caveat by saying it's still early days, but at the moment, we are consistently seeing these trends, and you can refer to the papers that Fisher and colleagues have cited. I'm going to now talk about a study that we've been conducting that's a cross-national study where we can look at the consequence of cannabis legalisation in early adulthood. So it's important to focus on what effect cannabis might have in adults. because we know that there is this evidence that it can have the effect of increasing use in adults. The study is called the International Youth Development Study, and you can see it's a collaboration between a number of different institutions. Here, the logos for the Social Development Research Group at the University of Washington, my own university at Deakin, and also the Centre for Adolescent Health at the Murdoch Children's Research Institute that have all been collaborators. The study is particularly comparing what's happening in Australia and the United States, particularly focusing on the comparison of the states of Victoria and Washington State, which is up here in the northwest of the United States. So these two states were picked because they had a number of similarities. The study aimed to compare the rates of health and behaviour outcomes in these two states, particularly focusing on the development of substance use, of what happens there, and how it relates to antisocial behaviour and mental health as young people grow up through adolescence into adulthood, and also comparing the longitudinal influence of range of risk and protective factors. And the third one was to look at school drug policies, the difference between this Washington State, where there was a focus on abstinence, and Victoria, where the policies were focused on harm minimisation. You can see that data collection was initiated with a large grant from the National Institute on Drug Abuse. Other Australian agencies have funded follow-up data collection. The sample was selected to be representative of students in 2002 in grade 5, 7 and 9, with exactly the same sampling framework used to collect data from students in Victoria and Washington State. So we have state representative samples. You can see we had a fairly large, ambitious study. There were roughly 4,000 in the eligible sample, of which we managed to recruit 3,000, almost 3,000. You can see equal numbers in both states, with the participation rate just falling under 75%. The retention rate has been excellent up until in the first 3 years from 2002, that was 2003 and 2004 follow-ups, 98% were retained in the sample. And here you can see at the age 25 follow-up in 2014 was 87% retention. Into the age 29 follow-up that was completed actually in 2019, started in 2018, we had an 80% retention rate. So these are excellent retention rates. Our intention is to keep following these samples up, but what is important about the study is that you can see that we have data collection in these years when the sample of average age was 13, 14 and 15 through the first 3 years of the study, matched samples in Washington State and Victoria. And then they were followed in 2014 when their average age 25. And at that point, recreational cannabis stores opened in Washington State. So the study then gives us the opportunity to compare samples in two different states, one where cannabis was legally available for recreational use. And we're going to today pursue the longitudinal outcomes at 2018 when they were 29. We will follow these findings up further in future years. And you can see here, 21 and 23 are targeted for further data collection. So the samples were completely matched for all characteristics that we thought were relevant, and including the Victorian samples being followed slightly later to account for seasonal variation. So the IODS findings at age 29, this was the sample that we started to survey in 2018, show higher cannabis use, so there's persistence of use from age 25 through to 29, and new uptake of use in Washington State compared to Victoria. So this is a finding consistent with what we were talking about a little earlier in the review study that showed a tendency towards higher rates of adult use with cannabis legalization. And so here, this finding would be consistent with that conclusion from other states that have been examined. If we look at the percentages, here we see the percentage of the population that was still in the study. By 29, we can see that when we look at the rates of use in age 25 and 29, that there were more of them in Victoria, marked here in orange, that had been consistently abstinent not using cannabis between ages 25 to 29. Of those who did use, there was roughly equal rates, just somewhat under 10% of those desisted. So a common pattern that occurs in the late 20s is that often young adults stop using drugs, and they can, in this case, we call that desistance. But actually in Washington State, in the blue, we see there were higher rates of persistence. So this is continuing use, with some almost 18% compared to 6% in Victoria. And there were also higher rates of new uptake, 12% compared to 6% in Victoria. So we see that there's a couple of patterns of overall trajectories of cannabis use between 25 and 29 that tend to be higher in Washington State, explaining the higher rates of use in into the late 20s. This pattern of continued use was predicted by risk factors that are associated with cannabis legalization. So in this study, we were able to ask young people about the availability of legal cannabis. So this was living near shops, purchasing cannabis legally, but also having it available in recreational settings, including sports clubs and social environments. And we looked at here we have a multiple regression adjusting for a number of covariates you can see listed here, and was examining the effect that availability had on age 29 use. You can see that it's a significant effect in Washington, but legal availability obviously has very little effect, scored 0. There was some availability in the sports setting and social environments, but much lower than in Washington State. Availability increased in Washington State from 25 through to 29. Prevalence refers to the perceived social use of cannabis in different settings, and here we've explored use again in social recreational settings, but also in your family of origin, in intimate partners, and in friends and work colleagues. And we look at the prevalence here. Here we see that prevalence, once you adjust for availability and acceptability, still has a significant effect in Washington State, but it's a larger effect in Victoria. So the model is showing that these things are predictive both in the environment where these things are legal and not legal, but prevalence, the perceived prevalence, increased from age 25 to 29 in Washington State. Acceptability, the view that people in those various environments, that social environments that young people within, that they believe that it would be acceptable to use cannabis. You can see these things have an equal effect in Washington State and Victoria. However, the perceived acceptability increased substantially from age 25 to 29 during through the legalization period in Washington State. So the risk factors have a similar long-term effect, but are larger in the legalization environment. So there's more use after cannabis legalization. And unfortunately, when we now look at the long-term effects of use, we find that there is actually still substantial harm associated with cannabis use. Here we next compare the environments of prediction in Victoria, Washington State, and in the combined sample. What we're looking at here is what is the effect of cannabis use in 2014, so at age 25, on consequences measured in 2018 at age 29. We compare the two samples, Victoria and Washington. Again, we have a number of covariates we're adjusting for, and we want to just look at the standardized coefficient of prediction. The standard errors are also listed here. And you can see that your use of cannabis in 2014, 4 years later, is a predictor of increased use in 29, or increased or stable use. You can see overall that it's contributing to higher rates of use. In fact, this effect is exactly the same in the different states. So non-significant means there's no state difference. Here we have an index of cannabis problems, the next thing we looked at in our analyses. And these were social problems, mental health symptoms, or injury and we had 8 items that we measured and we averaged here. Here we find that cannabis-related problems are actually significantly affecting, being predicted by cannabis use in both Victoria and Washington State and in the combined sample. The effect is actually stronger in Victoria, so it could be argued that the increased use of cannabis in Washington State was actually including a number of people who perhaps did not use it problematically, although the overall increase in use was still associated with problems. In Victoria, where you tended to use, even though there's slightly less rates of use, you're more likely to have problems in this environment. One of the worries that we have about cannabis use is the potential for it to lead to other forms of drug use. And here we see significant effects in both states, and they're very similar effects where your use of cannabis is predicting that you will be using cigarettes to a higher degree. So it's a risk factor for cigarette use in adulthood. Similarly, for opioid use, that you can see there's a similar effect in both states. Here we look at driving whilst using marijuana. Again, if you are using at age 25, there's an increased risk that you'll be driving using marijuana when you're age 29. The effect is actually higher in Washington State, consistent with the earlier review that I referred to, that shows this is one of the implications that happens under legalization, is there's more driving whilst using the substances. Depressive symptoms, here we actually find there's no state differences. The effect was not significant. There was low rates of the association in Victoria, but the overall combined results were such that we couldn't see an interaction effect. And in Washington State, it's a significant effect that if you're using in 2014, you're more likely to have depressive symptoms by age 29. Suicidal thoughts, again, similar predictive effect in both states. Cannabis use at age 25 in 2014, 4 years later, predicted higher rates of suicidal thoughts. For self-harm, again, we did see actually a slightly higher rate of predictive effects of self-harm in Victoria than Washington State, and this effect is significantly different in the two states. And perhaps again suggesting that there are some users that are picking up in Washington that don't have necessarily problems. Sleep problems, here we find that there were a tendency to sleep problems in Victoria that we couldn't see associated with this in the Washington sample or in the combined sample. Now, in this next set of overheads, I'm looking at a number of other types of problems that may be associated with cannabis use. We didn't pick up any predictive effect on relationship conflict or partner violence. There did seem to be effects on homelessness, and again, we couldn't see any difference between the effects. So cannabis use at age 25 predicted higher rates of homelessness at 29. For injuries and health, no effects, and we couldn't see those in either state. However, in the areas of financial difficulty and problems with income, these were things that we picked up significant effects in Washington State and in the combined sample, but we couldn't pick them up in Victoria. But when we looked for interactions, they weren't significantly different. So overall, what we're finding is that financial and income problems seem to be associated longitudinally with cannabis use. Unemployment or your entry into skilled work, again, we couldn't find effects for those. However, in the legal areas, there's some interesting findings. It's often said that one of the reasons for bringing in legalization is to reduce problems associated with crime. However, here we see that incarceration rates are actually quite predicted by your cannabis use, so that you're more likely to report incarceration in 2018 at age 29, in the case where you were using cannabis at age 25. And we see that this effect is actually significantly higher in Washington State. So that is, again, suggesting that you perhaps don't take away completely the association between cannabis use and crime. even though you've got higher rates of the use and it's recreationally legally available. For court offences, again, we found no differences in the rates of turning up to court. The effect was fairly small in Washington state, so that we didn't see it being significant effect. It is a significant predictor in the combined sample, but when we look for interactions, we don't see state differences highlighted as significant. So quite a lot of interesting findings. In summary, what the IOADS confirms is, consistent with prior studies, is that cannabis legalisation is associated with increased risk factors of availability, perceived prevalence and acceptability. These are, we would argue, some of the reasons why the cannabis legalisation is associated with increased adult use. So this is increased frequency of use. Other studies are showing increased use in potency. Unfortunately, this increased use there's no evidence at this stage that you're protected from long-term harms. We don't see that. We do see that there's some users that are using perhaps at moderate levels, but overall the increased use we see from the review studies that have been done at the moment is associated with increased hospitalisation and cannabis problems. So overall, the study here suggests that long-term harms overall are similar, even in the environment where it's legal. So the conclusions you can see from our study are fairly consistent with those that have been reported in previous studies. And so I look forward to further follow-ups of our own research and the ability to further interrogate the findings we have. But at the moment, they certainly do suggest a number of cautions associated with cannabis legalisation. I thank you for your attention.